We all know that there are 10 groups in Robson's criteria. Group 1, 2, 3, 4, group 5, 6, 7, 8, 9, 10. And how do we remember which woman falls into which group? So, to easily remember, we will start with group 8. In group 8, multiple pregnancy falls in this group. In multiple, there are 8 words, and so it falls into group 8. So any woman who may be nulliparous or multiparous, if she has multiple pregnancy, that is twin pregnancy or triplet pregnancy, she will be categorized as group 8. So group 8 is for multiple pregnancy, that is twin pregnancy or triplet pregnancy, irrespective of parity. Then comes to group 9, transverse lie. Transverse lie groups into group 9. In all women, irrespective of parity, she may be nulliparous or she may be multiparous. But if the presentation is transverse, the lie is transverse, then the women group into group 9. Then come into another malpresentation, that is breach. Breach comes in group 6 and 7. Breach with nulliparous, group 6. Breach with multiparous, group 7. So BN, you can remember it, BN, BM. That is breach with nulliparous, group 6. Breach with multiparous, group 7. So we have completed 4 groups already. That is group 8, all multiple pregnancy, that is twin triplet, irrespective of parity. And group 9, transverse life in all women, irrespective of parity. And group 6 is for breach presentation in nulliparous women. And group 7 is also for breach presentation but in multiparous women. Now come to group 10. All preterm pregnancy, that is gestational age less than 37 weeks, singleton pregnancy, cephalic in all women, that is nulliparous or multiparous, falls into group 10. Because singleton, we know that multiple pregnancy is for group 8. Other than that, all will be singleton pregnancy. So in group 10 is specific for preterm pregnancy, that is gestational age less than 37 weeks, and obviously singleton and cephalic. You can remember it as PSC. So in group 10, preterm pregnancy, singleton pregnancy, cephalic presentation in all women which may be nulliparous or multiparous are Robson's group criteria 10. And now the most common group of cesarean section causer is group 5, that is term pregnancy, singleton pregnancy, cephalic presentation, because we all know that multiple pregnancy is for group 8 and malpresentation is for group 6, 7 and 9. So definitely there will be, and preterm pregnancy is for group 10. So all other groups, group 1, 2, 3, 4, 5 contains term pregnancy, singleton pregnancy, cephalic presentation. Term pregnancy, singleton pregnancy, cephalic presentation. Term, singleton, cephalic. Term, singleton, cephalic. And group 5, term, singleton, cephalic. Because preterm falls into group 10 and multiple groups falls into group 8 and malpresentation falls into group 6, 7 and group 9. So in group 5 there would be term pregnancy, that is more than 37 weeks of pregnancy, and singleton pregnancy with cephalic presentation in multiparous women who has history of previous C-section. So in our country we often perform cesarean section because the woman has previous history of C-section. So those women falls into group 5. Now come into group 1, 2, 3, 4. So the primary criteria is same, term, singleton and cephalic, because preterm goes into group 10 and multiple multiple pregnancy falls into group 8 and malpresentation groups into group 6, 7 and group 9. So in group 1 there will be term pregnancy, that is more than 37 weeks. singleton pregnancy, and of course cephalic presentation. And parity, what's about parity and labor in nulliparous, and who goes into spontaneous labor, which is very important. Spontaneous labor. Woman goes into spontaneous labor, she is nulliparous. Term pregnancy, singleton pregnancy, cephalic pregnancy. If cesarean section is done in this lady, she will group into group 1. Now come to group 2. Same term pregnancy, singleton pregnancy, cephalic, and same nulliparous, same, but patient labor is induced, not spontaneous. Here in group 1, patient goes into labor spontaneously, but in group 2, she is term, singleton, cephalic, nulliparous, but her labor is induced or cesarean section done before labor. Because maybe because of fetal distress or oligohydramnios, then that lady falls into group 2. And in group 3, of course, there is term pregnancy, singleton pregnancy, cephalic presentation, but it is multiparous. So, and who goes into spontaneous labor? Same. Group 1 and 3 same, but group 1 nulliparous, but it is group 3 multiparous. So, term pregnancy, singleton pregnancy, cephalic presentation, multiparous lady who goes into labor spontaneously, but cesarean section is done for some reason, such as for meconium stent liquor or obstructed labor, then she will falls into group 3. Now comes to group 4. Term pregnancy, spontaneous, singleton pregnancy, and cephalic presentation. Term, singleton, cephalic. She is also multiparous, but labor is induced or cesarean section before labor, and woman underwent C-section for some reason like meconium stent liquor, fetal distress or obstructed labor, then she will be grouped into group 4. Let's discuss about some scenario. If you perform a cesarean section for fetal distress in a nulliparous lady, if you perform a C-section for fetal distress in nulliparous women who go into spontaneous labor, singleton pregnancy, cephalic presentation at term, then she will be Robson's criteria 1, because we know that in Robson's criteria 1, that is term pregnancy, that is singleton, cephalic presentation, and nulliparous lady plus labor, spontaneous labor. So all these criteria fulfilled. So this patient goes for C-section for fetal distress and Robson's criteria 1. Let's discuss about another scenario. I am very much sorry for my handwriting. Suppose you perform a C-section at 38 weeks of pregnancy, singleton, cephalic presentation with history of cesarean section. So which group he will fall into? So you see, that is term pregnancy, that is singleton pregnancy, and that is cephalic. And cesarean section is done for prior C-section. We have already discussed any cesarean section that is done because of prior C-section, that falls into group 5. So this cesarean section groups into Robson criteria 5. Let's discuss about another scenario. A nulliparous woman underwent C-section at her 38 weeks of pregnancy for breech presentation. So that is term pregnancy, singleton pregnancy, but that is breech. We all know that breech falls into group 6 and 7, and the lady is nulliparous. So the cesarean section falls into Robson's criteria 6, because breech nulliparous, Robson criteria 6, breech nulliparous, Robson's criteria 6, breech multiparous, Robson's criteria 7. So I hope you will understand the technique of remembering Robson's criteria, and in your word whenever you do cesarean section, you can categorize it and keep the data to find out which is the most common causes of C-section, and can work on that issue to decrease the rate of C-section and promote vaginal delivery. Thank you.